is the triad?
Well, we used to think as the triad, at least when it was first described, as essentially disorder eating, amenorrhea, which is the absence of menstrual periods, and stress factors. But now we know it's more of a spectrum in those disorders where the key component is the energy imbalance. We're essentially not consuming enough calories to meet our body's demands. And then that leads to problems. And amongst those problems, we have the menstrual disturbances, which can range from missing a few menstrual periods or delays in our menstrual periods to just complete amenorrhea, which is the absence of a menstrual period. And then the decreased bone density is also a spectrum of disorders. You can have athletes that have normal bone density. You can have athletes who have osteoporosis and of course, are increased risk for a stress fracture.
How long have doctors been studying this triad? I feel that many people probably don't know about it. This is the first time I actually hear the term as I was going over our notes for today.
For quite some time, actually. I think the first formal description came in the early 90s. But you know, the studies and the descriptions do date back from before that time, of course.
Okay. Now we're going to get more in depth with each of these points, but does an athlete usually experience all of these at the same time? So if you have one, does that mean you'll develop the other two?
Not necessarily.
Okay.
It's known as the triad and is described in conjunction to describe perhaps this unique disorder, but you do not have to have all the three components of the triad to actually have a problem. So that's very important and a very good question to ask. You don't have to see all the three components for there to be a problem.
Okay. So let's get into each of these points. First is the energy imbalance. I want to go into a little more depth. So why do female athletes have an energy imbalance? What's causing it? Well,
we can all have an energy imbalance, right? It's all about ins and outs. What comes into our bodies, what's the amount of calories we're consuming, and how many of those calories we're actually spending.
Okay.
But it's unique in the female athlete in the way that it presents, as the triad that we're talking about today. Is not something we see in men because men do not have a menstrual period, and the hormonal, the hormones in our bodies are different.
Right.
You know, in particular, the sexual hormones. So I just wanted that to be clear. We can all have an energy imbalance, but in the female athlete, particularly at younger ages, sometimes there's a bit more vulnerability.